So now we are going to discuss the Haemat33ozoa family, which is actually a part of the sporozoites. Remember, we were doing something similar to this called coccidian parasites. We are now going to go on and start off with the sporozoites, which will include malaria and babesia, of which malaria is what I'll start with first. So before I begin, something from PSM, World Malaria Day, April 25th, and the malaria month in India, of course, we know is going to be June. Right? Okay, so now let me tell you or basically introduce you to the different malaria or species that we have. So we have Vivax, Falciparum, Malariae, Ovale and Knowlesi. And what are they known as? Firstly, Plasmodium falciparum is known as malignant. If you can see, all of the others are benign. Falciparum is malignant. Malignant doesn't mean any cancer. Malignant means it has a more aggressive course, and that is going to be cerebral malaria, right? That is going to be cerebral malaria. Now, what do I mean by others are benign? They don't cause cerebral involvement, so that is also sorted for us. But what do I mean by tertian? Tertian refers to 3 and quartan refers to 4, hai na? So basically, when I'm saying that fever comes on the 3rd day, every 3rd day, this means the cycle must have gone on for 48 hours, 2 days, then the 3rd day fever comes. So basically, the cycle is going to go on for 48 hours, that is tertian. Over here also 48 hours, that is tertian. For ovale also 48 hours, that is tertian. But when I say Plasmodium malariae, that is quartan, means fever comes on the 4th day. After 3 days, the 4th day fever comes. 3 days matlab 72 hours. And finally, Knowlesi is quotidian. Quotidian means the cycle is only for 24 hours because fever is coming daily. So repeating, I can say that all of them are tertian. Tertian means 3rd day fever matlab after 48 hours. Only Malariae is quartan, and Knowlesi, the one that we hardly see in India, it is seen in Malaysia. I'll talk about it in the end. That is going to be daily fever. So now I want to ask you, what is the definitive host? We all know over here we are the intermediate hosts. We are not the definitive host. Definitive host is FAM, female Anopheles mosquito. That is going to be the definitive host. So first you will ask me, mosquito gives the disease to us and mosquito takes also something from us. Give and take hota hai between mosquito and us. So firstly, what is going to, so if I take, like for example, I am a human being, what is the form that I'll get from the mosquito? What is the form that I'll give to the mosquito? So what will I give to the mosquito? If I ask you, what am I going to give to the mosquito? You are going to say give matlab gametocytes. Ma'am, you will give gametocytes because mosquito is a definitive host. Mosquito ko wo pura sexual reproduction karana hai, male female gametocytes se. So you will give the gametocyte to the mosquito. And what will you take from the gametocyte? What will you take from the mosquito? If the mosquito is coming and biting you, saliva aa raha hai, then saliva ke through you are going to get sporozoites, SS. Saliva ke through you are going to get sporozoites. But if you have some blood transfusion, basically if it's blood related, either it's a blood transfusion or maybe it is mother to child transmission, then they are going to be T for T, that is trophozoites. As easy as that. Repeating, what are you going to get? If I get the saliva of the mosquito, I get sporozoites. If malaria is coming by a blood transfusion, I get trophozoites. Whereas what am I going to give to the mosquito? We give gametocytes. So I think we are ready for the life cycle. Firstly, this is not a life cycle that you'll get for identification ever, because as soon as you will see that there is a human being over here and there is a female Anopheles mosquito mentioned over here, you know it's a case of malaria. So what am I going to do? Now tell me guys, over here the female Anopheles mosquito is taking a blood meal, matlab saliva. Saliva is going to be injected in me, means which form? S for S. The sporozoites are going to be injected. So here we've been bitten and the sporozoites have been injected. So the first cycle that it has to go through, you will say, ma'am, ye to RBC wala parasite hai. It is supposed to go to the RBCs, correct? It is supposed to go in the erythrocytic cycle. However, please remember, this is before going there, it is going to go into the exoerythrocytic cycle. So what is the exo? Outside the red blood cell. Outside the red blood cell basically means it's going to go somewhere in the liver. So what happens? What came in our body? We had sporozoites in our body. Sporozoites are gradually going to infect which cell? They are going to infect the liver cells. And what are they going to form? They are going to form the schizons. Schizon banega, schizon rupture hoga. Schizont is going to rupture. This is exoerythrocytic cycle because it's not in the red blood cells, it's outside the red blood cells. So sporozoites will come, schizont will form, it will rupture. So that is what will there. So ruptured schizont, say what is going to happen? Now it's going to go and get deposited on the red blood cell. Now it is the time that it will go and get deposited on the red blood cell. So now it has entered the erythrocytic cycle. So for example, if this is a red blood cell, guys, let me label this. How will I say that, okay, Plasmodium vivax hai, so how will it come and bind? If it is Plasmodium falciparum, how will it come and bind? So please note that for Plasmodium vivax, for Plasmodium vivax to bind, all of us have something called Duffy antigen. All of us have Duffy antigen. So Plasmodium vivax binds to Duffy antigen. And if Plasmodium falciparum will come, what will it bind to? There is something which is known as BASI gene. Plasmodium falciparum is going to bind to BASI gene. BASI gene is CD147 if you want to learn, but I don't think that is important information. So Plasmodium vivax will come and bind to Duffy antigen on the red blood cell. Plasmodium falciparum will come and bind to BASI gene on the red blood cell. So finally it has taken entry into the red blood cell. And what is going to happen in the red blood cell cycle? TSG. TSG ka matlab is not gonna be tumor suppressor gene. TSG are the stages of malaria. T for, I'm gonna teach you, trophozoite. Trophozoite से क्या बनेगा? Schizont banega. You will say, ma'am, after this schizont, either I can have, see, there are two things. From this trophozoite, either there is going to be a schizont formation, schizont will rupture, again that cycle will keep on going on. So remember, when this schizont ruptures, that is when patient has fever. So every time the schizont will rupture, patient has fever. Every time the schizont will rupture, patient has fever. So one option is that the trophozoite is going to form schizont and schizont rupture hoga, wo वापस RBC पे जाएगा, the cycle is going to go on and on. However, the trophozoite can also form gametocyte, and this gametocyte, male, female, जो भी gametocyte होगा, whom will this be given to later on? This will be given to the mosquito. So now, please remember, the mosquito has got the male and the female gametocytes. What are they going to do? Of course, they are going to mate, and they are going to result in the formation of ookinete. Ookinete is something which is motile. Ookinete is motile. After that, it's going to become non-motile because it's going to become an oocyst. That is going to become non-motile, that is an oocyst, and that ruptured oocyst will then rupture and it will release what? It will release all the sporozoites. So now these sporozoites are going to come and stay in the saliva. So when the mosquito will bite us, the sporozoite saliva se sporozoite will enter into us. So what was this? What kind of a cycle is this, ma'am? This is sporogenic cycle. This is the sporogenic cycle. So I call it the sporogony. This is sporogony, and let me tell you, please note, this is going to take 10 to 14 days to occur. This cycle in the mosquito takes 10 to 14 days to occur. So you know what is this known as? This is known as the extrinsic incubation period. See, whatever had to happen in us would have been inside our body intrinsic. Whatever is happening out there is going to be extrinsic incubation period. So I want all of you to quickly help me with this. What all did you study for malaria? If I had to summarize that very, very quickly, chalo, let's do that. Firstly, you will have a human being over here, and along with that, you will have someone biting it, that is female Anopheles mosquito. If it is the saliva of the female Anopheles mosquito coming, this means the sporozoites are going to come to us. As soon as the sporozoites come, there is one cycle known as the cycle in the liver, and then there is one cycle which is going to happen in the red blood cells. So, the red blood cells hai, that is the erythrogenic cycle, and the other one is going to be exoerythrocytic cycle because it's outside the red blood cells. So, what happens? There is going to be schizont that will be formed. Every time the schizont will rupture, when the schizont will rupture, all the merozoites are going to go, and they are going to go and attach all those ruptured schizont se jo merozoites niklenge, they will go and attack the red blood cell. Okay, in the red blood cell, how are they going to form? There are three stages, TSG, trophozoite schizont. So ya to schizont rupture hota jayega, trophozoite schizont, that will keep going on. Or the trophozoite can take a root and form gametocytes, means there is going to be male-female gametocytes, which we are eventually going to give back to the female Anopheles mosquito. In female Anopheles mosquito, these male and female are going to form an ookinete. After an ookinete, it is going to form an oocyst. And from this oocyst, all the sporozoites are going to be released. So this is happening as sporogony. This is sporogony, and this is going to take 10 to 14 days. That is the extrinsic incubation period. I hope you've understood. Itna detail mein no one will ask you, but this is only for your understanding, because now you can let me know that how much of gametocytes was given to the mosquito. How many gametocytes have to be there given away to the mosquito, that we are saying that, you know, the infection has gone to the mosquito. So at least 12 gametocytes have to be given per microliter of blood. Please remember, at least 12 gametocytes. When you are giving, at least 12 gametocytes must be present per microliter of blood, so that the infection can be given to the mosquito. I hope everyone's okay with this, because now I'm going to start off with the overall incubation period. So what is overall incubation period? Kitna time liver mein laga plus kitna time blood mein laga. What am I saying? The overall incubation period is going to be this. How much time did this process take in the liver? How much time did this 1 or 2 cycles of process in the RBCs? That is the overall incubation period. Everything, let me tell you, for Vivax and ovale is always going to be similar, 13 to 17 days. Everything for Vivax and ovale is going to be similar in the story. So 13 to 70 days. Now falciparum is going to be fatafat. Fatafat is going to be 12 days. So it's a little shorter than Vivax and ovale. Then we have malaria. Malaria is going to be a very lazy one. Lazy one matlab it's going to take 1 month. So remember, malaria ko month lagta hai. Malaria ko month lagta hai. And Knowlesi to knows it all. Knows it all means it's going to be even faster. Knowlesi knows it all. So it's going to be a very less incubation period of 8 to 10 days. Dobara karte hain. Vivax and ovale are friends. Everywhere you will see Vivax and ovale are going to be friends. 13 to 17 days. Falciparum thoda sa fatafat, 12 days. Knowlesi knows it all and is going to happen very, very less incubation period time hai. So 8 to 10 days. And this malaria is going to take 1 month. ठीक है, 28 to 30 days. And what is the incubation period? The liver and the RBC, दोनों का schizogony I have combined and then I've called it. Now you need to know 3 definitions out here. What is cytoadherence? What is rosetting? And what is agglutination? And this is specially, it can be seen in all, but it is specially with respect to Plasmodium falciparum. So what I'm going to do over here, we'll draw one red blood cell. And before I start, why am I focusing on Plasmodium falciparum? Because which organ does it go and involve? It is definitely involving the brain. It is causing cerebral malaria. So please note what is happening over here is that, for example, if this is a red blood cell and this red blood cell has been infected by Plasmodium falciparum. And if this is a blood vessel, guys, what is the lining of the blood vessel? Lining of the blood vessel, we all know by now, are the endothelial cells. So you know what these red blood cells do when they are infected with Plasmodium falciparum? Plasmodium falciparum starts making some knobs. That is what Plasmodium falciparum does. It will start making some knobs known as Plasmodium falciparum erythrocyte membrane protein. You really don't have to know the full form. I told you just to kill the curiosity. So erythrocyte membrane protein or Plasmodium falciparum, basically it is making knobs. You know why is it going to make knobs? Because these knobs will go and bind to ICAM that is present on the endothelial cells. So can I say the cells will get adhered? There is cytoadherence. So this concept of the knobs binding to ICAM1 is referred to as cytoadherence. One thing. Next, if all these cells, ये जितने भी knobs वाले cells हैं, if they start getting agglutinated with each other, now I'll draw lots and lots of RBCs. ठीक है, I'm going to draw lots and lots of RBCs, and all of them are infected with Plasmodium falciparum. So all of them are going to agglutinate. All of them have these knobs. Knobs दिख रहा है मतलब Plasmodium falciparum. So what is agglutination? All the parasitized red blood cells agglutinate. All the parasitized red blood cells are going to get agglutinated, or you can say clumped. That is auto-agglutination. And what is rosetting? कि ये तो parasitized थे, तो they were agglutinating. But then we do have some red blood cells which are normal, na? Some red blood cells are totally normal. Now you know what will happen in rosetting. Rosetting mein all of them will also come and combine with each other. So please remember, the definition of rosetting is that the parasitized and the unparasitized cells will clump. Parasitized and the unparasitized cells are gonna clump, and that is known as rosetting. So repeating, what is cytoadherence? Adherence means that the cells are going to stick onto the blood vessels via which receptor? ICAM1. What is that's why I call it autoagglutination. Auto matlab apne aap mein. The parasitized cells apne aap mein they are gonna agglutinate. But what is rosetting? Rosetting is going to be the parasitized and the unparasitized cells. These are all going to clump together. Sorted? Should we move on to another form of malaria? Because I now keep on telling you that, okay, this is the malaria that has happened to you with female Anopheles mosquito. But I also told you that there is a malaria that can happen via blood transfusion. And can you help me with this information that if you're talking about blood transfusion, which is the form that you've got? You've got trophozoite form, T for T. So now going all the way back, you will realize that this is the stage you've got the malaria at. ये वाला पूरा cycle तो गया, nothing is gonna, now directly you've got trophozoite, so you just have to deal with this cycle. You don't have to deal with the liver wala cycle, so that exoerythrocytic cycle is gone. The exoerythrocytic schizogony is not seen. This means that the incubation period is gonna be very, very short. Simple. In blood transfusion malaria, one entire cycle has only not been there. This means the incubation period is very short. Now, what is this that is written? Relapse, hypnozoite. So it's important that we do 3 definitions. What is pre-patent phase? What is relapse? What is recrudescence? But pehle ek ratta laga lo. When I will use chota wala word, that is relapse, you will put it up in the chota wala malarias. That is, vivax is a chota wala term and ovale is a chota wala term and relapse is a chota wala term. Okay, so vivax and ovale are going to show you relapse. Recrudescence is a really lengthy name. So Plasmodium falciparum is a lengthy name. Plasmodium malariae is a lengthy name. So jo recrudescence hai, that is going to be present in the lengthy wala name. Rat liya? Relapse is present in vivax and ovale. Anyway, I was telling you vivax and ovale are brothers for lifetime, and recrudescence is seen in falciparum and malaria. Now I can tell you the definitions. So what is firstly? Let's begin with what is pre-patent phase. Pre-patent phase का definition है from the time that the saliva of the mosquito entered the sporozoites into me to the first parasite that I form in the blood. Going back from the time the mosquito gave me a sporozoid to the first parasite that I form in the blood, that is the pre-patent phase. Basically, I am putting like patent karna, something I'm putting on my name that yeah, I have also made one parasite. So from the time of the entry till I making the first parasite, making it patent that I have made malaria, that is pre-patent phase. What is relapse and what is recrudescence? See, relapse means that there is gonna be a comeback. Relapse हुआ. Comeback क्यों हुआ? Somewhere malaria slept off in your body, and after some time it woke up. Means where did it sleep off? Remember over here, in the liver sometimes there is gonna be formation of hypnozoites. Hypnotize हो गया. As soon as the sporozoites entered from the mosquito, in the liver they went and वो hypnotize हो गए and they slept off. And later on they suddenly got out of their hypnotized state and they got activated. That is known as relapse. So remember, relapse refers to what? It is gonna be the hypnozoites which are getting activated, and that is what you'll see in the liver, right? So now you understand. In the previous one when I was teaching you blood transfusion malaria, when I said that the entire liver wala cycle is not going to be there, so जब liver wala cycle नहीं होगा तो hypnocytes will never form, and hypnocytes are never formed. This means relapse will never be seen. Relapse is never seen with blood transfusion. So simple, in blood transfusion malaria, your direct cycle starts from trophozoites. Trophozoites means RBC wala cycle. Liver wala cycle is only not there. When the liver cycle is not there, this means the hypnozoites will never form, and if they will never form, blood transfusion malaria will never have a relapse. Who will have a relapse? I told you chota wala names, that is vivax and ovale will have a relapse. Understood? Okay, what is recrudescence? Recrudescence is you gave treatment, but there was a problem in the treatment. So this is gonna be a case of inadequate treatment. Or you can say there is some resistance to the treatment. So this is a treatment related thing, and it is seen in all the long things, na? Falciparum and malaria. So repeating once again, relapse is a hypnozoid sleeping and waking up. Recrudescence is a problem in the treatment. Relapse chota word vivax and ovale mein hoga. Recrudescence long word falciparum and malaria mein hoga. Understood with this? Now we move on to the clinical features finally of malaria. Then the diagnosis. So clinical features include Benign malaria has febrile paroxysms. I think you know this from day-to-day life. What is febrile paroxysms? First, the patient is going to have a cold phase. Cold phase ka matlab, there is going to be chills that are going to be there. There is going to be shivering that the patient is going to have. Along with that, there is a hot phase. Basically means that the patient is going to have fever, and then the patient is going to sweat it out, and there is going to be fall in the fever. So these are known as febrile paroxysms that occur. But why do they occur? When do they occur? You know when do they occur? Whenever, now going back, whenever in the red blood cell, every time a schizont will burst, jab se water balloon burst hoga, that is when there is going to be fever. So every time that happens, there is going to be fever. That means that, for example, there is erythrocytic schizogeny. Every time there is erythrocytic schizogeny, the RBCs are rupturing. That is when febrile paroxysms occur, and they ask you the most important cytokine for fever over here is TNF alpha. The most important cytokine for fever, TNF alpha. So remember, fever is because of the RBC wala cycle. This was benign malaria, that cold phase, hot phase, sweating phase. But what is the malignant malaria that I told you? Malignant malaria was associated with Plasmodium falciparum, isn't it? And that is cerebral malaria. Cerebral matlab brain involvement. There is headache, there is nausea, confusion, paralysis, coma, all brain related things are gonna occur. I want to ask you something from pathology. Guys, come on, is there any granuloma that you see in malignant or cerebral malaria? There is something known as Derg granuloma that I have taught you in your pathology lectures, in your RR also, in your snapshot also, so many places I have taught you. So I hope you remember, Derg granuloma is going to be there in Plasmodium falciparum, everything to do with the brain. What else? You know, RBCs are breaking. At the end of the day, RBC ka problem hai. RBC breakdown is going to occur, and if RBC breakdown is going to occur, this means there is going to be hemoglobinuria, hemoglobin in the urine, because it is going to be intravascular hemolysis. And that means this can be known as black water fever. Patient will say, I'm passing black water in the urine. That is nothing but RBC breakdown. Next, there can also be nephrotic syndrome. You go back to your renal pathology and I have taught you that nephrotic syndrome can occur because of malaria. Yes, I have taught you that. But which malaria? Now I'll tell you, it is a feature with Plasmodium malariae. It is a feature with Plasmodium malariae that nephrotic syndrome can occur. I have taught you this way back, and I've even taught you which type of nephrotic syndrome. I've taught you membranous glomerulonephropathy. Go to MGN in your pathology lectures and it's written over there. What else? Sometimes, and in many patients, you must have seen that splenomegaly bhi hota hai. That is known as tropical splenomegaly. But for the spleen to enlarge, it should be a long term. Spleen will not enlarge in 4 days. For the spleen to enlarge, it has to be either long term infection or repeated infection. And tropical kyun bolte hain? Because this is very commonly seen in tropical countries. So firstly, for the spleen to enlarge, it should be a long-term malaria. Tropical because it's occurring in tropical countries. Also, why does the spleen enlarge? The spleen enlarges because there is reticuloendothelial hyperplasia. Kitna fancy naam bola. What are reticuloendothelial cells? Nothing but macrophages. So macrophages are always given one fancy name called reticuloendothelial cells. So remember, tropical countries, splenomegaly, long-term infection se hoga, and reticuloendothelial cells are going to be affected. Finally, if there is any circulatory failure that happens with malaria, if there is any circulatory failure that happens with malaria, you're going to refer to it as algid malaria, right? So these are the different types of malaria. But before I go on to the other parts of malaria, I want to quickly mention about this Plasmodium knowlesi, which I was not talking much about. Only thing I told you was it is quotidian. Quotidian means that there is going to be fever daily, 24-hour ka cycle hota hai. And secondly, I told you that this is something which is not seen in India. I told you the incubation period, it is a knows it all. So jaldi incubation period hoga within 8 to 10 days. And please remember, this is M&M. Malaysia mein tha from monkeys, not really reported in India as of now. Before I start with lab diagnosis, I want to make all of you familiar with the concept of pathology. Which are the people who are immune against malaria? So, pehle to please note, for malaria to enter into the red blood cells, especially Plasmodium vivax, if it has to enter into the red blood cells, it needs an antigen called Duffy antigen. So, simple. All of us have Duffy antigen, so malaria will enter us. People who don't have Duffy antigen, malaria will not enter them. So, you might feel, array, Duffy antigen nahi hai, problem hoga. Patient is lucky. He doesn't have Duffy antigen. He's actually had a benefit. He's not going to have vivax infection. He's immune. Secondly, if you talk about all these hemoglobin and RBC problems, sickle cell trait, thalassemia or G6PD deficiency, ovalocytosis, if you realize, देखो hereditary spherocytosis या ovalocytosis, G6PD deficiency, don't you feel the RBC lifespan has only gone down in them? Don't you feel over here the RBC lifespan has overall gone down in them? Now when the RBC will only not survive, so what will the malaria survive? है ना, malaria survives in RBC. RBC is only not surviving over here, so person indirectly becomes immune. In sickle cell and thalassemia, the hemoglobin is only low. The hemoglobin production is only not occurring. Rather than saying hemoglobin is low, I will say the hemoglobin production is not occurring. Now when again the red blood cell is not surviving, hemoglobin is not surviving, how will malaria survive? And fetal hemoglobin can also make it immune, because fetal hemoglobin keeps so much of oxygen affinity that organisms cannot grow. So remember, all these conditions and the absence of Duffy antigen, all of them make it immune to malaria. We are ready for the lab diagnosis. I will tell you a long list of lab diagnosis, but I have a request. Please do not take my bread and butter away from me. So remember, whether it is a pathologist or a microbiologist, malaria season सबसे beneficial season होता है हमारा, which means that light microscopy is still the gold standard. You might have CART tests and you might have a million other tests, but light microscopy is still the gold standard. Always remember. So first, I will start off with here. I'll keep coming back to this slide. Okay, I'll keep coming back to this slide one by one. Let's start with light microscope. So what do I have over here? I have a slide. Of course, we'll have to make a slide for this gold standard. We make something known as a thick smear. You can very well see what is a thick smear. I've taken 1 drop of blood and you've not spread it too much. You took 1 drop of blood and just spread it to a circle. You know, many people ask me, how thick does it have to be? It has to be so thick, like for example, if you keep it on a paper, if you keep this slide on some paper, you should be able to read the text behind it, just be able to read it. So neither very transparent nor opaque. That is how we say, you just keep a newspaper behind it, you should be able to read the alphabets little bit. That's it. That is the thick smear. And then thin smear is how you make your smears in your practical. You take 1 drop of blood and you make a tongue-shaped smear. When you take make a tongue-shaped smear, that is a thin smear. So first you will ask me, what is the reason for making two smears, one thick, one thin? So remember, thick smear is only done because you want to quantify the malaria. 100 parasites are there, 500 parasites are there, 2000 parasites, you want to quantify. But in thin smear, because everything is so thin, you will be able to do the species identification. You will be able to tell me, oh, is it vivax or is it falciparum or what is it? So remember, thick smear is done only to count, acha haan, malaria 1, 2, 3, 4, 5. But thin smear is to tell you, oh, this is vivax or falciparum. And what is you are saying, ma'am, I'm a pathologist or a microbiologist. Both, anyone with a microscope is basically entitled to do this. So pathologist, microbiologist, dono karte. How many, fields will I look? I can't keep looking at this slide all day long. Kab tak dekhna hai? So I will say, if you find malaria, then to just report it as malaria. Stop looking at it. If you don't find malaria, if you're planning to give the patient negative for malaria, you should have examined at least 200 to 300 oil immersion fields. Oil immersion fields means you are going to identify this in oil. Oil ka kya magnification hota hai in microbio? I have told you the 100x magnification. So remember, to 100, 200, 300. 100 wale field mein, matlab oil immersion field में 200 or 300 fields you should have seen. Then you say, अच्छा अभी भी नहीं दिखा तो मतलब it is negative. But is this the best test in terms of sensitivity? Not really. देखो, thick smear के लिए, because you're taking more amount of blood, your sensitivity is still good. It is 5 parasites per microliter also. If you have in the blood, you will see it. For thin smear, because the amount of blood is very less, it's very thin and spread out, you should have at least 200 parasites per microliter of blood to be able to see it. So thick smear has a better sensitivity, 5. Thin smear has 200. So now you will say that, okay, slides are ready, ma'am. What is the stain that you're going to put? So we always in hematology, hemat ka problem ho gaya, ye blood problem hai, to Romanovsky stain. And let's see how many of you have read pathology from me from hematology section. Tell me the Romanovsky stains, all the family members. There is something called the Jimsa stain. Then there is something referred to as the Leishman stain. Then there is the Wright stain. Then there is the Jenner stain. All this I have taught you in pathology. And there is a field stain, out of which, let me tell you, F for F ka mnemonic tha. Field stain is an important stain for which Plasmodium? For falciparum. You can use any of these, but as per the national malaria program of our country, what we have to use is the Jaswant Singh and Bhattacharya stain. Jaswant Singh Bhattacharya stain is what we are going to use. JSB staining is what is preferred for malaria. That is as per our malaria programs. Okay, so your staining has also been done. Now, before I move forward and show you all those pictures, I just want all of you to know that these are the 4 families. So before we begin, we should be knowing that look at these 4 species: Vivax, Falciparum, Malariae and Ovale. Under these, you should be knowing that, please note, Vivax and Ovale definitely have one kind of group. So Vivax and Ovale may, if I ask you which set of red blood cells will it affect, it is going to be affecting the young RBCs. Vivax and Ovale are going to affect the young RBCs, and those RBCs are going to become enlarged. So they are going to become large. So you can learn it as whatever mnemonic you can make out of it, but if you just have to learn one of these so that the others can become opposite. Anyway, Vivax and Ovale are going to involve the young RBCs, and it is going to be the large RBCs. However, all the others show you normal RBCs, and all the others like Falciparum में all आता है ना, तो it will affect all ages, young ages also, old ages also. Malaria is an old man matlab it is going to be old RBCs only. So like I said, if you've learned one, then you've learned all the others. So simple, Vivax and Ovale में they are going to be young RBCs, and the young RBCs are going to become very, very large, so they are enlarged RBCs. Also, another thing on which you don't get a picture, but you get theory questions. What are the dots and clefts that you see? Iske liye we have a mnemonic. You see these microscopically, but you won't get a picture on these. Remember, Vivax shows you Schaffner's dots. These are all microscopic features. Falciparum shows you Morer's clefts. Malariae shows you Zeeman dots, and Ovale shows you James dots. How am I going to learn it? Please remember, Viva exam mein examiner is always going to keep shuffled questions. Viva exam mein examiner won't ask you chapter wise questions. So Viva exam mein everything is going to be shuffled, right? So Schaffner dot dikhega. When you write falciparum, can you read it opposite? If you read it opposite, it is sounding like MAUR. So it is going to show you Morer's clefts. Next, when you say Plasmodium malariae, you're going to see man dots. So malaria mein dikhega Z man dots. That is how I have learned it. Malariae is going to show you the presence of Z man dots. Okay? And finally, Ovale. How many alphabets? 1, 2, 3, 4, 5. Which dots? James. 1, 2, 3, 4, 5. Although they are saying Vivax and Ovale सब कुछ same tha, तो Schaffner भी same कर दो. You can see that, but yeah, till now the textbooks mention Ovale shows you 5 alphabets, James shows you 5 alphabets. हो गया, now it's simple. Viva में shuffle the questions. Then you have Falciparum, तो MAUR, Morer's clefts, Malaria, man dots, and Ovale is going to be James. Out of them, which of them are the young RBCs? So Vivax and Ovale में, remember, young RBCs and large RBCs. Okay, this is done. Now finally I can take you to all the pictures one by one that I will show you. But what is going to be common to all Vivax, Falciparum, Ovale and Malaria is that we have malarial pigment. Malarial pigment kya hai? That whenever malaria comes into our body, hemoglobin is changed into hemozoin. So if you look very carefully into this cell, you will be able to see a brown color dot over here, and this brown color dot is nothing but this brown color dot is the hemozoin or the yellow color pigment. That is a property of almost of all malaria species. Yellow ka color varies, but property is seen by all. Hemozoin pigment is gonna seen by all in the malaria. Now let's start one by one. So rather than showing it to you like this, I will start first with Plasmodium Vivax. And for everything you have to know TSG. What is TSG? So the first form that you have, please remember, the first form that you have in Plasmodium Vivax, the T is going to be trophozoite. And in simple words, if you want me to tell you, trophozoite is going to be the ring form. So how many rings do you see over here? I see one ring, and in that one ring I see one dot. So that is how I've learned it. Dekho, Vivax is having that V wala sound. So Vivax is everything 1, 1. Vivax, 1, 1. 1 ring, 1 dot. And as you see over here, yes, of course, there is 1 ring and there is 1 chromatin dot. That is what? That is an early trophozoite. This is early trophozoite. As it becomes late, can you see? Maybe there is 1 ring and 1 dot, but that ring has become a little mota. That ring has become a little mota, so this ring form is known as amoeboid form. This is now referred to as the amoeboid form. Do you want to see actual pictures? Have a look at this. Look at this, guys. The first picture over here. How many rings? 1 ring, 1 dot. This must be the early trophozoite. This is the early trophozoite because I am seeing the beautiful 1 ring, 1 dot. But after some time, it starts looking like this. It is still a ring. It is still 1 ring, 1 dot, but that ring has become so mota. That ring has become so mota. So this must be a late trophozoite. And when I say late trophozoite, that has got a very weird shape, and that is known as the amoeboid shape. So everyone's okay with the trophozoites? Yes, repeat them once again. The early as well as the late are done. Early ho gaya, late ho gaya. Let's come back. After T, we had the S. So TSG karna tha na. This means now what I have next are the schizons. Schizons kuch nahi hoga. Early ho, late ho, you will see dot 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 inside it. What are those dot dot dot? Dot 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 are nothing but merozoites. Remember, schizon was that water balloon. Every time it bursts, person has fever. So this is what a schizon looks like. Dekho, uske andar dot 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 hai. That dot 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 are merozoites. So these are the schizoids that are present. Done. Now coming to TSG. The G stands for gametocytes. So first and foremost, you have to know there is a male and there is a female. Which is macro, which is micro. Remember, the micro word will always be used for whom? It will always be used for males. Males are going to be microgametocytes, whereas females are gonna be macrogametocytes. Dekho, female ko zyada importance. You have to give more importance to females. So females are always called as macrogametocytes. Males are called as microgametocytes. Can you see the structure? Both of them are looking round. So Vivax, remember Vivax, like you were doing 1 ring, 1 dot. Vivax is going to be oval gametocytes. They are spherical, or you can, in simple words, from now onwards, you can refer to it as oval gametocytes, whether it is male, whether it is female, oval or spherical. How do I know male or female? If the chromatin is in the center, that is going to be male. And if the chromatin is at the eccentric, then it is female. So please remember, if there is a central chromatin, it is going to be a male gametocyte. And if it is eccentric chromatin, it is going to be a female gametocyte. Let's have a look at some pictures. Firstly, oval hai. Oval matlab Vivax ka gametocyte hai. And after that, if I see, look at this. Tell me, over here the red color chromatin is eccentric. Ma'am, ye to females ka tha. Females matlab give them importance. Macrogametocyte is going to be towards the side. On the other hand, the red color chromatin is in the center. Center matlab it was in males. Males are known as microgametocytes, right? So please remember this. This is how the entire Plasmodium vivax story looks like. This is vivax story, right? So you see 1 ring, 1 dot, that can become amoeboid form. Then there are schizons. Then there are oval gametocytes. Now we move on to the next one, and that is Plasmodium falciparum. Does this also have the same trophozoite, schizont and gametocyte? Yes. But please remember, this was also causing something known as cerebral malaria. Now, when this is causing cerebral malaria, it means some things are going to stick inside the brain vasculature. So remember, schizons are going to stick in the brain vasculature. Schizons will only be present in the cerebral blood vessels. They will not come out into your usual blood vessels over here. So will you see this in the blood? No. Remember, schizons are not seen in blood samples. Good for us. Good for us, not for the patient. Good for us because I don't have to know the photo. Means for Plasmodium falciparum, I just have to know the photo for trophozoite and gametocyte, and that's about it, because schizon doesn't come out in the blood. So how does the trophozoite look like? So Vivax ka ulta karo. Vivax was 1 ring, 1 dot, isn't it? So what is this trophozoite going to be? Over here, there are multiple rings. There are going to be multiple rings, and there are going to be multiple dots. There are multiple rings and multiple dots that are noted. You can zoom in and see. See, you're seeing two rings. Two rings and they're having two dots. Some people start making their imagination run wild. They say, this is looking like headphones. This is looking like earphones. Yeah, you can use any of your favorite things that you want. This is definitely there. But imagine there are so many of them. For example, if too many relatives come into your house, there's some family function, these rings are your relatives, too many relatives come. There will always be that one angry uncle relative of yours who will mind some minor thing that I wasn't asked for a glass of water and will go and sit in one corner. Na? So most of you must have thought of that angry Fufaji's meme that always comes. Same way, when there are too many rings over here, one ring says, "Arey jaga nahi hai, I am going and sitting in the corner." That ring decides that I'm going to go and sit over here. It has gone and got stuck on the margin. So what is that known as? That is referred to as the acole or the applique form. That is referred to as the acole or the applique form. That basically means that there is margination of the ring. The ring decides that I'm going to go and sit in one corner. Okay, margination of the ring is going to be there. So remember, there are lots of rings when there are lots of dots, and apart from that, some dots got angry like a relative and went inside in the corner. So do you want to actually see the same thing that I've taught you? Look at this. Are you seeing like multiple rings in every RBC? Of course, lots, 2, 3 of them. And are you also seeing multiple dots? Can you see like two dots everywhere? Yes. But can you see one ring is sitting at the corner? This must be that acole or applique form that I'm talking about. Acole or applique form is what we are seeing over here, that marginated angry relative. So trophozoites to ho gaya. Schizon to happy news. Dekhna hi nahi hai. Now we come to gametocyte. Again, the story is the same. The microgametocyte will be given to the male and the macro word will be given to the female, because females ko zyada importance. And what is the shape that you're seeing over here? The shape that I'm seeing over here is banana. Banana shaped gametocytes, male and female ka banana shaped gametocyte is seen. How do I differentiate? Look at this. Females are usually thinner and males are usually broad. Hai na? So remember, the males are going to have broad ends. Sabse pehle the males are going to have broad ends and the females are going to have a little pointed ends. This is the common sense. But in the exam, ma'am, I will never be able to differentiate broad and pointed. Kuch aur batao. Look at the chromatin. The chromatin is all spread out. That's a male. If the chromatin is well organized, it's a female. Think of the girls' hostel ka room versus boys' hostel ka room. Girls are usually more organized. They like to keep their stuff in one place. So if the chromatin is organized, it is highly likely to be a female gametocyte. But if boys' hostel ka room dekho, everything is here and there. So this is how all the things are spread. That is, if the chromatin is spread out. If the chromatin is spread out, matlab ye male gametocyte. Although honestly, this is a very cliche, kind of an example that I give you, because you come to any girls' hostel room also, it's always a mess. Every hostel room is a mess, but because for our mnemonic, I had to make this. So females ka room well organized, chromatin well organized. Males ka room all messy and all everywhere, so chromatin is spread out. Let's see the same thing under a picture. Look at this, guys. I can kind of assume ye pointed hai to ye female hoga, or ye round hai to ye male hoga, but this won't help me in the paper. The chromatin will help. See, if the chromatin is all out, it's a male. If the chromatin is all in the center, organized in the center, so these three over here actually which are organized must be a female. Whereas these three that I'm seeing over here, these three which are all spread out, this must be a male. And if you see in the same picture, I can see the trophozoites also. Mujhe wo double ring and double trophozoid rings are also seen. So this is a beautiful picture that we have. So falciparum is done, vivax is done. Now we come to malaria and ovale. Story unme bhi wahi chalega. There is going to be trophozoid, there is going to be schizon, there is going to be gametocyte. The only difference I want you to know it is that in malaria, look what I'm saying, in Plasmodium malaria, there is, instead of a ring kaisa hota hai? Ring aisa hota hai. Instead of a ring, it's a pichkawa ring. The ring gets squeezed. So instead of looking like a ring like this, the ring is looking like a band. So remember, Plasmodium malariae is going to show you the presence of a band form. That is something which is important over here. Rest everything is wahi TSG story that is going on. I hope everyone's okay. This brings you down to the 4. Vivax, falciparum, malariae, ovale, all of them show you hemazoin pigment. And coming all the way back, I had told you in the lab diagnosis, the first thing that I will be talking about is the light microscopy. I am the gold standard. Okay. Now, if you want to do some other fancy wala microscope, that is known as the fluorescent microscopy. So please note that for fluorescent microscopy, we have in a way, please note, fluorescent is something which is said to be one of the screening modalities. And when I say screening modalities, it is it's a very rapid screening modality. It's a very, very rapid screening modality that we have. In fact, although, let me tell you, fluorescent microscope is not something that everyone can afford. It's very, very expensive. But definitely, it is something which is coming across as very, very important for us in the exam. So, it's a rapid screening modality, but it's very, very expensive. This is known as the Kawamoto technique. I wouldn't elaborate much on this because way back in your general microbiology, I told you what is the fluorescent dye that we use for malaria, and that is going to be acrid in orange. So the three questions that you can get in this is going to be, what is the other name for the fluorescent dye that we are using for malaria? It is Kawamoto technique. What is the dye that we use? Question 2, acrid in orange. And this is the screening method of choice. It's a very rapid screening method. Now let's move on to the next one. There is something known as the microhematocrit or the QBC. Microhematocrit or QBC, pehle to you will all have to know the full form. So QBC refers to quantitative buffy coat. These are the pictures that you're going to get. QBC refers to quantitative buffy coat analysis. So first you need to know what is a buffy coat. Quantitative, so you've understood, I'll be able to count, but what is the buffy coat thing? So whenever you take blood and you spin it, if you basically make it undergo centrifugation, you know what you're going to get? You're going to get all the red blood cells over here at the bottom. You will get all the plasma wala part at the top, but where did all the WBCs and the platelets go? There is a tiny little zone in the center, and that is going to be known as the buffy coat. So please remember, there is going to be the plasma and the red blood cells and the buffy coat that is going to be there. So now I am interested in buffy coat because all the organisms are going to come over here. Remember, malaria settles in the buffy coat, and even later on in the last chapter when you study filaria, that also settles in the buffy coat. So you will say that, ma'am, I don't have to look at the entire blood. If I'm wanting to look for malaria, I will just look at this buffy coat. Exactly. So quantitative buffy coat means that, why did I call it microhematocrit? The other name for it is microhematocrit, because I will take a patla sa tube. Remember that tube in which you used to do bleeding time, clotting time in your physiology practical, that patla tube? You take one finger prick, fill that tube, you spin that tube. In this machine, in this QBC test, you have a machine, wo patla tube iske andar you will keep, you will spin the tube, you will get the buffy coat, and you will say that, theek hai ma'am, spin bhi kar liya, buffy coat bhi mil gaya, here I have the buffy coat in front of me. Now what? How should I look at the malaria? If I have to look at malaria, I'll have to look at it under the microscope. But how? Have you added any dye? Now I'll reveal something. In this tube, from beforehand, you have a dye that is present. From beforehand, the company has added a dye, a fluorescent dye. And what is that dye? What did I say? A company has added a fluorescent dye. This means this was already coated with acrid in orange. This I was not aware. When the company gave me this tube, it was already coated with acrid in orange. So now when I look at this tube, I'll place this tube under the microscope. I'm not going to see the entire tube. I'm only going to see this buffy coat area. I will start seeing the malaria shine out like this. Whatever malaria is there, trophozoite, gametocyte, jo bhi hoga, all of that is going to shine out like this. So that is the QBC test, because it is going to use the quantitative buffy coat method. Please remember, the sensitivity is equal to 2 parasites per microliter of blood. It is 2 parasites per microliter of blood. So it is really sensitive, but the problem is that it is sounding only such an expensive machine. You need that tube, then you need that centrifugation wala machine, then you need that fluorescent dye, too many things needed. This is very complicated. So of course, अच्छा है, but it is definitely going to be a little complicated. So this is also done. अब आगे क्या चले, क्या क्या हो गया? Light microscopy done, fluorescent Kawamoto done, microhematocrit and QBC done. PCR, of course, will be the most sensitive if you can afford to do that for malaria. But what we are actually doing for malaria in most of the cases is RDT. What is RDT? RDT stands for, after COVID, you guys are very, very well versed with what is RDT. It is a rapid diagnostic test, or in other words, it is going to be a card test. In other words, it's going to be a card test. So be it any card test on this planet, or hepatitis B, C, HIV, typhoid dot wala card test, या COVID wala card test, या urine pregnancy card test, or any other card test like malaria, the principle is gonna be the same, and that is immunochromatography, ICT. Immunochromatographic testing is the principle for it. And what is the sensitivity? 50 to 100 parasites per microliter is the sensitivity out here. So this is what a card looks like. Let me tell you, ICT, immunochromatographic testing, is the principle. And can you see a membrane inside it? This has something known as a nitrocellulose membrane. This has a nitrocellulose membrane inside it. And I can see one hole over here is going to be for the buffer, and one square over here is where we are going to add our blood sample. So this is going to be for the blood sample. So buffer and blood sample will mix. Control line though has to be there, because control line is going to tell me the validity of the test. Control line matlab everything is fine, my buffer is fine, blood is fine, everything is fine. Control though has to be there. The test line is going to tell me whether there is malaria or no malaria. So I'm going to actually show you a lot of these tests. You have malaria written on every card, but kya kya dikha hai? Control, you'll say control line तो मैम ठीक है, I have understood. Control line तो has to be seen. तो यहाँ दिखा, मतलब it's a valid test. Control line यहाँ पे है valid test. Control line है valid test. यहाँ control line is not there. Don't read it. Throw this card away. Ask for a fresh card, fresh sample. This is a wrong test. Something wrong has happened. Either blood was clotted or this kit is expired. कुछ तो गलत हुआ है. Just don't read it. So control line has to be there, that's a validity. Then you will start seeing whether it is pan malaria or only falciparum. You will say, why this discrimination, ma'am? All the malaria you have kept under one and falciparum alag se rakha hai, because falciparum causes cerebral malaria, right? So you need to know the urgency of it. But how is this working? Remember, all the malaria species, listen to me very carefully, all the malaria species have AL for aldolase. They have aldolase in them, and the remaining L for LDH. So what is the principle? All the malaria species have what antigens? They have AL for aldolase and L for LDH. So ye to yaad ho gaya, all of them are gonna have this. But only Plasmodium falciparum has histidine-rich protein 2. This is a recent exam question. Only Plasmodium falciparum has a histidine-rich protein 2, which is very, very important for you to know. So this means that I can pick up Plasmodium falciparum. This means that Plasmodium falciparum has this also. When I said all malaria species have aldolase and LDH, means malaria, vivax, ovale, falciparum, malaria, everyone has it. So even falciparum has these two also. Something extra falciparum has. Falciparum, apart from aldolase and LDH, it is also going to have histidine-rich protein too. So now tell me, if you don't get any line, देखो control का line तो आया था तो valid है, but यहाँ पर there is no line. So what is your answer, ma'am? This must be negative for malaria. Here you get a control line, valid है, and you get a line in pan malaria. Pan, but not in falciparum. You will say, ma'am, कोई भी हो सकता है. It can be Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. But one thing is certain, that Plasmodium falciparum नहीं है, because falciparum में line नहीं आया. When I came to this one, I got a line in pan also. I got a line in falciparum also. So this is to certain के falciparum है. See, falciparum has HRP2, that is why it gave a line here. Falciparum also has aldolase and LDH, so it could give a line over here also. So falciparum to hai, but what if this was a case of a mixed infection? What if this was a case of, say, vivax plus falciparum? Just example. So vivax would have given a line over here, and falciparum will give a line in both places. So two situations, either it is a mixed infection or it is only falciparum. That is when you get a triple line. So if you get a triple line, either it is falciparum or it is falciparum with something. And this means you don't know the final answer. That is why I'm coming back to the point that I am really important. Gold standard is me. I am gold standard. Light microscopy, right? That is why, because cards are not going to be that reliable. And that is your RDT, Rapid Diagnostic Card Test. Principle, immunochromatography, membrane, nitrocellulose membrane. All the malaria have aldolase and LDH. Plasmodium falciparum has histidine-rich protein 2. Malaria, sigh of relief, is done for us. What are we going to move on to next? Let's give you a spotter. What is this? Again, you'll say, ma'am, rings ही तो दिख रहा है. ये तो Plasmodium falciparum and vivax जैसा rings है, but those rings are making a tetrad. Over here, the rings are making a tetrad. So there are a tetrad of rings formed like a cross. 4 rings are making a cross. That is known as Maltese cross appearance seen in Babesia. And that is what I'm going to start with next. Babesia, like malaria, is also something in the red blood cells, but इसमें malaria वाला pigment नहीं होगा. Life cycle is different and no pigment is there. So what is the host? Definitive host is actually going to be a heart exuded tick. An intermediate host is going to be some mammal like rodent or cattle or all of those, right? So we are to bilkul end mein. Babesia mein we are like the accidental hosts. So basically, malaria mein, what were we in malaria? Definitive or intermediate? Malaria mein main to female Anopheles mosquito tha. Malaria mein humans were what? We were intermediate hosts for a change, right? But in Babesia, we are not even that. Babesia mein to hum bilkul hi barbad hain. We are accidental hosts. We have been thrown to one corner. Matlab good for us, but we have been thrown to one corner. How many types of Babesia do you have? Babesia microti, Babesia divergens. How will you learn it? My Babesia microti. Alag alag kar lo. Roti will remind you of ratty. Ratty means the host is going to be rodent. And my will remind you of mild. It is a mild disease. Ho gaya yaad? Remember, microti tells me micrati. From today onwards, call it Babesia micrati because it's going to occur in the rat. And the mild infection will be there, whereas Babesia divergens alag ho gaya. It's going to be cattle and it's going to be a very severe infection. And please remember, why is it so severe? Because in these patients, usually this happens because the spleen has been removed. Whereas why is Babesia microti or micrati very normal, or why is it milder? Because spleen is there to fight for you. So if the spleen is there to fight for you, disease mild hoga. When the spleen is only not there to fight for you, then the disease is going to diverge out in many spectrums and result in the severe infection. Be it whatever case, remember the question that comes is what is the way of spreading? Hard exuded tick. And what do you get under the microscope? You see a tetrad of rings, Maltese cross appearance. Is that okay with everyone? So clinically क्या होगा patient को? There is a typical something like I told you na, malaria का भाई है, fever with chills and sweating, same वाला चीज. The treatment is going to be as if AA. The treatment is going to be azithromycin with etovaquone. That is going to be the treatment. However, if it is very, very severe, and when do I say it is very, very severe? When more than 10% parasitemia is there. In that case, I will give IV clindamycin with quinones. So quinines are going to be given. Quinines and clindamycin will be given in more than 10% parasitemia. But that is going to be the end. But before I end, one question I want to tell for all the INI CET aspirants, that this Maltese cross appearance that you just discussed, where else do you see it in path and micro? एक तो अभी Babesia में देखा, right? But other than that, where do you see it? One more place in micro. Cryptococcus का CSF also shows you this. And where do you see it in pathology? If you see the urine of a Fabry disease patient, Fabry disease के patient के urine में बहुत lipid होता है. Any lipidaceous urine, like for example nephrotic syndrome के patient में lipid होता है. Any lipidy वाला urine is going to show you this Maltese cross appearance. And if you want to know that glove powder, if you ever look at it under the microscope, na, that also looks like Maltese cross. So these two are primarily important. Fabry's is very important for pathology because any lipid thing will show you Maltese cross, and micro mein Babesia is the most important. And yes, we are ready for some MCQs. I hope the first one you read very carefully and are not in a hurry. 22-year-old male patient presents with fever and chills and blood counts show hemoglobin OK12, TLC 13,000, DLC में क्या है? Neutrophils are 50, lymphocytes are 29, monocytes are 20. I hope you remember from your general pathology again. I had taught you way back in the other subject. In patho, I had taught you कि monocyte बढ़ता है, malaria में monocyte increases. Peripheral smear shows the presence of RBCs and presence of applique forms. As soon as I say applique forms, acole forms, I'm talking about Plasmodium falciparum. However, few of the RBCs are showing the presence of band forms. If they are mentioning band form, it is going to be Plasmodium malariae. There's a student of mine who made a mnemonic called Mala band. Mala band matlab ye jo Plasmodium malaria hai, that is going to show you band forms. In case you had forgotten, Mala band is what you will learn. So guys, dono dikh raha hai, matlab this was a case of a mixed infection. Don't be in a hurry. Many students just read applique and marked falciparum. Many students read band and marked Mala band, but this is both. So this is a mixed infection. Let's move on to the next one. What is your diagnosis? There is a triple line that you see. Is it for falciparum, Vivax, for non-falciparum, mixed infection, or A and D? So you'll say, ma'am, triple line में हमने कहा था या तो pure falciparum है, option 1, या फिर it is falciparum plus something, so mixed infection. So basically both these possibilities I will have to keep. So option E is the best answer. Next question, which of the following is incorrect about antibody detection for the diagnosis of Plasmodium falciparum? Is it based on the principle of immunochromatography? Yes. CART test, correct. Does it detect the aldolase antigen, aldolase, LDH? Yes, all malarias have aldolase and LDH. Does it have HRP antigen? Of course, Plasmodium falciparum has now, but this is wrong statement. Why? Because it has histidine-rich protein 2. What a way of catching you. Very, very sadistic examiner. And so this is histidine-rich protein 2, which Plasmodium falciparum has. So that becomes the wrong answer over here. So we are done with the sporozoa. I hope you guys have benefited from it.